Hi.
Hi.
Hello, hi.
Nice to see you. So, we're here today to talk about occupational travel health.
Yeah, occupational travel health is a blend of two medical subspecialties, occupational health and travel medicine. And it's all about safeguarding the health of the international business traveller.
Could you expand on that a little bit?
Yes, so what we're talking about here is a dynamic workforce, by which we mean a highly mobile group of employees who work internationally to deliver growth for an organisation. And it's vital for them to be at the top of their game in terms of delivering what are business critical results. So to actually invest in their health and well-being is really critical to the whole business.
So occupational travel health is a very holistic approach then to looking after the employee.
You know, these individuals are delivering very strategic benefits for the organisation, and so it's not about just getting by, it's about them really thriving, being on top of their game when they're performing in these roles.
Yeah, so I think it's really important to have strategies in place in order to prevent health issues during travel. And pre-travel health screening provides an individual medical review and risk assessment, and that can help identify health hazards and then put measures in place in order to reduce risk.
Yeah, I think when we think about health hazards, we often immediately think about external hazards, so whether it's malaria, perhaps air pollution, and I think we can overlook internal hazards, that is threats to health within an individual, if you like, the things that they take with them to the airport when they begin their travel. So that might be an undiagnosed medical condition, or perhaps it's risk factors, high blood pressure, or perhaps a particularly high body mass index.
That's right, and I think internal hazards can vary considerably between individuals, and a good health management strategy equips and enables an individual to be able to carry out their business travel regardless of their health status and internal hazards.
That's very interesting. So you're saying that, for example, a young female business traveller going to an area where, for example, Zika virus is prevalent would have a different outcome from their risk assessment than a middle-aged male business traveller who might have already developed high blood pressure or diabetes.
Yes, that's right, and a targeted plan can then be put in place to enable the traveller to continue to be able to carry out their business objectives.
Michelle, you're absolutely right. We're all about facilitating people travelling, but sometimes there is the need for the big call. And that is to say sometimes, no, it isn't appropriate. You're not fit to carry out this particular assignment.
Yes, absolutely, Simon. And that's another really good reason why pre-travel health screening is so important. So this information can be captured and these calls can be made.
And then I think you can see the direct, as you invest in individual resilience, just what it does in terms of business resilience, and the correlation between the two. Makes perfect sense, doesn't it? I think the whole COVID pandemic has really highlighted the importance of understanding the variability within individuals, their vulnerability to particular threats.
Yes, absolutely. And to give an example of a condition that's come up a bit in our pre-travel screening, is inflammatory bowel disease, and the symptoms of this condition can be quite unpredictable. And the sorts of things that we might think about in terms of their pre-travel preparation, we'd advise that they make a clear plan in case of a flare of their disease during travel, and that might mean alterations in their medication or perhaps having some standby antibiotics to take as well. So it's really important to focus on the individual.
Good health is more than the absence of disease.
Yes, absolutely, yes.
Absolutely, yeah, I agree. And it's not just about sudden incapacity, the possibility of a sudden loss of capacity through a medical emergency, heart attack, for example, but also what we might call subtle incapacity. And that's a kind of more gradual drop-off in performance.
So this is then where that holistic sense of well-being, of psychological resilience, of good physical health and being able to withstand the stresses of travelling whilst being a high-performing employee for a particular business clearly makes a huge difference.
Yeah. But the sort of jobs we're talking about, there's a need for a high level of capacity. These are not tasks that you can do simply on autopilot. You're actually having to draw within yourself all your different gifts and abilities, and you do that when you're in a place of well-being, of thriving. I think the whole COVID pandemic has really highlighted the importance of psychological well-being. I think we've all seen the importance of that.
And I think when these things are not addressed, it is quite easy to get into a vicious cycle of exhaustion, underperformance, negative feedback.
Yeah, I mean, I think that's exactly what I was meaning by subtle incapacity. So it doesn't happen overnight, but gradually, through successive trips, issues not being addressed, there's that, as you say, a gradual deterioration in someone's performance that really does start to impact on the business and its effectiveness.
So the role of the Occupational Health Travel Service is one of regular engagement with the business traveller, of regular support.
Yeah, absolutely. I mean, I think traditionally you might have thought of occupational health as just intervening where things go wrong. This is about increasing capacity. It's enabling a business to be more effective in what it's doing. So I think there's a focus on the individual, but it's for the benefit of the whole. The success, the growth, the development of the business.
An example of this would be a large company has recently invested £45 million into counselling for mental health issues, into psychological resilience and wellbeing training for all their staff. And within a year of making that investment, they have calculated a £276 million return of their investment in the prevention of sickness absence.
I mean, what a perfect example of investing in individual resilience and then the benefits, the fruit in terms of business resilience. Because as individuals thrive within business, then you have the ability for the business as a whole to thrive.
Brings us back to Michelle's earlier point. Prevention is better than cure.
Yes, absolutely, yes.
Yeah.
Yeah, no, I agree with that.